Did you know a small stumble in your own kitchen could be your body quietly warning you, months before an actual fall ever happens? Most people miss these signals completely, because they don't look scary, they look normal. In this video, I'm walking you through 7 warning signs of poor balance and rising fall risk after 60, backed by research. Doctors recommend watching for. Stick around, because sign number 7 is the one almost everyone ignores. Here's something encouraging before we start. Balance is a skill, and like any skill, research suggests it can be improved at almost any age. But first, it helps to know what to look for. Falls are one of the most common causes of injury for adults over 65, and many are preceded by small, easy-to-miss warning signs, sometimes for weeks or months. This video isn't about scaring you. It's about helping you notice these signs early, so you can talk to your doctor, take simple action, and stay steady, active, and independent for years to come. Let's start with sign number 1. Sign number 1, you find yourself trailing a hand along the wall or furniture as you walk through your own home. It feels harmless, almost automatic, but researchers say this kind of light touch support is often one of the earliest signs the body is quietly compensating for shakier balance. Most people don't even notice they're doing it. If you or someone you love reaches for the counter, the doorframe, or the hallway wall out of habit rather than need, it's worth mentioning to a doctor at your next visit. Catching it early is what makes it easy to manage. Sign number 2, needing to push off with your hands to stand up from a chair or the couch. Watch how your legs feel next time you rise. If your arms are doing most of the work, that can be associated with weaker leg muscles, which play a huge role in staying steady on your feet. The good news is that this is one of the most improvable signs on this list. Gentle strength exercises, the kind a doctor or physical therapist can recommend safely, often help people regain the ability to stand up using their legs alone within just a few weeks of practice. Sign number 3, feeling briefly dizzy or lightheaded when you stand up quickly. This is sometimes called orthostatic hypotension, a temporary dip in blood pressure when you change position, and it's associated with a higher risk of stumbling right after standing. Many people wave it off as just standing up too fast. But if it happens often, it's genuinely worth a conversation with your doctor, since it can sometimes be adjusted with simple changes. And speaking of things people wave off, the sign that surprised researchers most is still coming, so keep watching. Quick check-in, how many of these have you already noticed in yourself, or in someone you love? You're not alone, and you're definitely not out of options. In fact, most of these signs respond really well to small, consistent habits. Let's keep going, because sign number 4 is one almost nobody thinks to test for at home. Sign number 4, difficulty standing on one leg, even just for a few seconds. Try it near a sturdy counter for safety. Some research has linked the ability to briefly balance on one leg with overall stability and lower fall risk in older adults. If it feels wobbly or impossible right now, that's simply useful information, not a reason to worry. Balance training, like standing near a counter and practicing daily, is something many physical therapists recommend, and small improvements often show up faster than people expect. Sign number 5, your steps have gotten shorter, slower, or a little shuffly compared to a year or 2 ago. This change often happens so gradually that family members notice before we do. Walking speed is something doctors sometimes use as a general marker of overall stability, because a shorter, more cautious stride can be associated with reduced confidence and balance. If someone mentions you're walking differently, try not to brush it off. It's simply a helpful signal that it might be time for a checkup focused on strength and mobility. Sign number 6, and this one surprises people, quietly avoiding activities you used to enjoy, like stairs, uneven sidewalks, or crowded places, simply because you feel unsure on your feet. This growing caution is sometimes called a fear of falling, and researchers note it can actually reduce activity levels over time, which may affect balance even further. It's completely understandable, and nothing to feel embarrassed about. Naming this feeling out loud, to a doctor or a loved one, is often the first step toward feeling confident again. And here's sign number 7, the one almost everyone ignores: having a near fall, a stumble, or a quick grab for support in the past year. We tend to laugh these off as clumsy moments and forget about them by dinner. But some research suggests a near fall can be just as meaningful a warning sign as an actual fall, because it points to the same underlying balance changes. If you've caught yourself even once this year, that's not something to feel embarrassed about. It's valuable information, and exactly the kind of thing worth mentioning at your next doctor's visit. So what can you actually do? Start by talking to your doctor, especially if 2 or more of these signs sound familiar. They can check things like blood pressure, medications, vision, and inner ear health, all of which can play a role in balance. From there, many doctors recommend simple daily habits, gentle strength and balance exercises, a vision checkup, supportive shoes with good grip, and clearing loose rugs or cords at home. None of this requires a gym or special equipment, just a little consistency. Small, steady steps genuinely add up over time. Let's recap: trailing your hand along walls, pushing off with your hands to stand, dizziness on standing, trouble balancing on one leg, shorter shuffling steps, avoiding activities out of caution, and near falls you brushed off. Here's your one action step for tomorrow: pick just one, and mention it to your doctor at your next visit. That's it. If this video helped you, hit subscribe to Health After 60 for more practical, science-backed videos on staying strong and independent. And if you're ready for more, check out our video on the 5 foods every senior should eat daily, right after this.